We're here, we're queer, and we will continue to change the world. Welcome to Queer Changemakers. I'm your host, Justin Mezzapin, pronouns he, him, and each episode will share stories of LGBTQ plus individuals who are taking action to make a difference in our communities and beyond. Welcome to another episode of Queer Changemakers. Today, our guest is Dwight Venson.
Hello. Thank you for having me.
I'm glad we finally got this on the schedule and get to have this conversation.
So we
So,
we met at a Team Racine event and you were telling me about your podcast and I'm like, this handsome man is coming up to me talking about this platform that he created. I'm like, I have to get in on this.
awesome. I'm glad because from the other side, I'm just like, wait, you're with Whitman Walker. Y'all do so much and you're like in the community at all these events. And I'm like, I want to have y'all on my podcast. I've been in DC a very long time. So I've heard of Whitman Walker ever since I started going out and seeing what the queer community in this area is about. So I'm glad to have someone from a great organization here. I said it a little bit, but would you want to tell the guests who you're with and what you're working on these days?
Yeah. So, hello everyone. My name is Dwight Venson. I am, a queer change maker, I would like to believe,
There you are.
because I am community engagement manager for Whitman Walker. A lot of queer folks in particular know Whitman Walker as an LGBTQ and HIV serving organization, and that's our legacy. We're very proud of that work, and that's historic work, but it's work that we're also still doing today. But we would like to welcome more people to the expansion of our services. So today, Whitman Walker is a federally qualified healthcare center, which means that we receive money from the federal government to work with specialized populations. And in our case, we offer full primary care services, dental, we have pharmacies at both of our locations, 1525 on 14th Street and the Max Robinson Center in Congress Heights. We have legal services, so we're helping with gender and name change markers, as well as immigration status changes. We help people that don't have insurance get insurance with our public benefits team. So you really name it, Whitman Walker has it in-house. And so I'm really just the big cheerleader as the community engagement manager in the community, trying to spread the good word about the depth of our services and connecting with folks like you that recognize our historic legacy.
Awesome. I love that. So the way things are right now, healthcare is always a challenge, it seems. And having people who understand you, it just makes talk going to the doctor a little bit easier. And getting all those other services.
Right.
And especially if y'all are able to like do so many of them, that helps. Like,
Under these conditions as well.
yeah, yeah. So that's awesome. That's awesome. I remember like a long time ago, Whitman Walker used to do like the walk-up testing clinics during the week. And it's just great to have an organization that's just been part of a community for so long. So what got you personally into there? How did you get into that role?
So I am originally from Cleveland, Ohio. So I'm
Mhm.
DC transplant. I came to DC around 2017, immediately after I graduated college. And like many people, I found myself immersed in all of the liveliness of this city compared to where I come from. And I was also walking my own personal journey with my family and friends from back home with coming out as a gay man and embracing my sexuality. And there was just so many things happening at that time. I specifically came to DC to go to grad school. So I started to pursue a master's at Georgetown. But because there were so many things going on in my life at that time, I didn't commit to school. And so I'm not ashamed to say Georgetown put my butt right on out. And I found during that period that I was a little bit lost, not knowing what direction that I wanted to go, having to contemplate all of these personal and now professional problems. I was really at a crossroads. And it was at that moment that I decided the one thing I could take control of was my sexual health. And so I decided to go and get tested. The beautiful thing about the HIV work in DC is how interconnected the community of folks that are doing this work really are. And so I found myself getting tested by a gentleman named Arturo, who happened to be a health impact specialist through DC Health, which was a workforce development program that DC Health sponsored specifically for Black and Brown queer folks, where DC Health would hire us, train us, and then dispatch us to various healthcare organizations around the DMV area. So I got pulled into that workforce development program from getting tested by Arturo. And that's really how I got immersed in this public health world. I wanted to come here to be in politics, believe it or not. My background is political science. The program that I was pursuing at Georgetown was urban planning. So I had a very different vision for my life. But that one moment of just saying, hey, take a step back, let's focus on sexual health really got me wrapped up into this public health world. And so from there, I've just been able to build a career. It served as a launching pad that got me various positions. It helped that I had degrees and some background of experience. But Whitman Walker felt like the perfect next step for me as an elevation in my career, from doing the grassroots HIV testing to now serving as more of a public face community figure and connecting folks to resources as opposed to being the resource distributor. And so that's my wild story, at least the PG version of that story.
Sounds good. Sounds good. I mean, we can go in any direction, but we can keep it there. But I do love that. It's one of the things I love about being in DC, even over the past year and a half. Every time I've traveled in other places, people are like, oh, you're in DC. You're like, I was in Chicago when the National Guard was deployed in August. And they're like, are you scared to go back or this? And I'm like, we'll see what it's like. And after that, going places, people are like, so what's it like? Are you okay? And I'm like, you know what? Yes. I personally haven't had an incident with them, so that definitely colors my response. People who have had experiences, can really speak to those extra levels of challenges.
Yeah.
But for me personally, I'm like, I get to be in DC. Like, there's so many organizations here that care, that are like working together, that are taking care of ourselves while resisting things that need to be resisted.
Yeah.
And like you were saying, how DC government had a program to help train people and put them into jobs. We were very lucky to be here. And every time I talk about DC, I'm like, this is a place to be. Even no matter who's in the White House, the city cares. The city does its best to care about all of us.
Yeah. As
Um,
Mayor Bowser says, we're the gayest city in
yeah,
the country.
we're the gayest city in the country, but also we are still very black and brown hair, and they care about us from that perspective too. And there's a lot of those programs that are doing their best. So like, how do we help people in all the different parts? So health, economics, work, all the good stuff. I love it here so much.
Yeah. I
Hmm.
will say all those pieces, it's difficult to make them make sense a lot of times, in the sense that as a service provider, we're constantly struggling with resource allocation is, I think, a big challenge for a lot of us. And then meeting the complex needs of our patients at a given time. I know housing continues to be a particularly tough issue for us, and it was tough before the pandemic. So I think that adds a lot of context to the fight that we're up against even today. Just in terms of the HIV landscape in particular, the story that I told of a lost boy discovering his way in the HIV community, even that landscape has changed so much.
Mhm.
I'm not sure that the Health Impact Specialist program is offered anymore, but, there's still a lot of celebrations and resources that we can uplift and recognize despite the cloudiness that seems to loom over DC now.
Yeah, I feel like it's maybe last year someone said it. It's like, got to go back to our roots,
Right.
right? Like some of the things that have changed over the past year never existed 20 years ago. And further back, it was even worse. So it's like appreciating where we are, knowing that there's still more to go, and finding community and collaborations with other organizations that are like, no, we still have our flag planted and we care. Okay, so in your current role, what's been a couple highlights that you've got to experience in this role?
I love this question. So, I was brought on as a community engagement coordinator. So, of course, I was so proud when about a year and a half into accepting that position, I was promoted to community engagement manager, which is my current role. And that was no easy feat for me. It took a long time to plant my feet in that organization and learn all the inner workings. So for me, being a part of the opening of the Max Robinson Center, we used to be located on Alabama Avenue, downtown Anacostia by the big chair. Now we have this huge medical center. And so being there to be a part of the construction site,
Hmm.
it's in the ribbon cutting with Mayor Bowser and council members, was truly special. And then stepping into the role as community engagement manager and that sort of happening alongside the opening of our Max Robinson Center really instilled in me the importance of focusing on communities east of the river. It was like lightning happened, a shift just immediately took over. And I found such great community and connection in focusing my energy in communities Ward 7 and 8, those communities east of the river. And there's so much of those communities that remind me of back home in Cleveland, just the resilience of the communities there, hearing about the advocacy that already takes shape there and how they take care of themselves, despite all the data that reports about their historic marginalization. I love communities east of the river and working with those communities. So I would say just learning more about those communities has truly been the biggest highlight of my career.
I know that because every so often we might see certain communities or certain places as other or different or this, that, or the other. But it's like once you're inside them or see people, it's like, wait, we're all just people. We all like to laugh at jokes. We all like to have a good time. We all want to be healthy and take care of our families and do what we got to do.
And they have good soul food, which
Uh,
is probably the most important aspect.
yeah, yeah. We all like to eat and we all like to eat good food. And yeah, some places food is better than others. No offense. Okay, okay. So that's one of the highlights. So in your role as community engagement manager and just working with Whitman Walker, what's the challenge that you're facing in this?
I think people hear the name Whitman Walker and it comes with a lot of loaded assumptions. I think a lot of Black and Brown, as well as the trans community, and rightfully so, have a very complicated history with Whitman Walker. I often hear the name White Man Walker thrown out and hear about a lot of the historical injustices because of past practices. And so for me as community engagement manager, folks might assume it's just easy to show up, but in a lot of instances, it's very difficult to be a part of pride events with other very celebrated, well-known Black organizations and to represent this organization that I know has a very complicated history with a lot of folks in the room that may now have assumptions about me and my character. And so just being able to navigate those spaces with dignity and grace and the understanding that the work that I'm doing now is it's such a contradiction to those negative perceptions and the people that I know that work at this organization, that run this organization. We have two women of color that are at the helm running the organization. We're in such a different place. And then, of course, if you work in nonprofit, you know what I'm about to say. It's back to the age-old resource allocation question. Doing this work as community engagement, anything, it's really complicated. It really needs dedicated time and attention. And I'm a one-man show. Aside from me, there's one other lady on my team that runs communications, and it's just us in the field doing the work,
Yeah.
trying to make it happen, trying to make Whitman Walker look good for doing all the great stuff that Whitman Walker does. But that's a lot of time and energy. And so, like many other organizations, it's just all about how to best use the resources that we have at a given time.
Mhm. That's fair. Both perspectives. Resource allocation, especially after 2025,
Yeah.
is a big challenge, especially for this year. Last year, there was a conversation, like a LGBTQ town hall at the mayor's office of LGBTQ affairs, and they brought people from all different organizations and community members to show up. And I think from the mayor's office, they're like, it's going to be hard. Like this year, the current year has been hard. And then looking at budget decisions for next year, it's like last year had more resources because of the previous year's budget.
Yeah.
But like going into 2026, it's like there are going to be some hard choices that need to be made. And they're all hard choices. It's like we don't know. And especially with like things politically with the healthcare subsidies that may or not be existing in the future, it's like how do you that's going to require more resources from the city. And then the resources that usually could go out aren't going to come out as well. So it'll be interesting.
Yeah.
Um,
And for me, particularly thinking about those communities east of the river that I love, and a lot of folks that live in these communities are not as tuned in into that information as early as they probably should be. And we're talking about cuts to Medicaid or changes in city programming, lack of job opportunities, all of these things that are coming down the pipeline this year, but really, as we're looking towards next year, are just going to continue to get worse and worse. We're really trying to think through how to best address these problems and how to continue to safeguard those that we hold closest to us because while resource allocation continues to be a major problem, it's always been. And so I choose to believe that we have some of our brightest minds. Our CEO, Naseema Shafi, continues to be on the front lines of working with other community-based organizations to really have conversations about how to safeguard resources in those communities east of the river. And so that's a little bit of where I find hope and inspiration, but it's still very serious and very real and very right now.
yeah. And it's, I don't know, for the next couple of years, I know, probably for all of life, it's holding on to both of those things. The
Right.
hard realities that do exist and the real problems and struggles that are here that we have to address.
Yeah.
And also the hope and joy and the good parts. Because I
Yeah.
think if you focus only on one, it's not the truth of full reality.
Yeah.
Yeah. And so the other challenge you had mentioned, and I think this episode will be released during Black History Month. Our community has had a lot of struggles in the past, and some of it was created by organizations, or not, maybe not created by organizations, but maintained by organizations. So, like, just because someone's queer doesn't solve all of our issues because we have this extra thing.
Well, let me tell you an interesting story. I'm going to tell you a very interesting story because I think it connects to this is 100 years of Black History Month, by the way.
Mm,
So, the Jewish Museum recently did a exhibition that was featuring a lot of queer history and how the Jewish community has handled queer issues. And this exhibition was showcased around World AIDS Day. So it had to do with, in particular, how the Jewish community responded to the AIDS crisis and the queer community that was largely impacted by it. They contacted Whitman Walker for one of our representatives to host a panel. And when I got there, I realized that the panel was largely made up of individuals that were also of the Jewish community, but that were on the front lines of the very beginning of Whitman Walker. So, thinking about Whitman Walker's history, you go back to the 80s and the AIDS epidemic. Whitman Walker actually started in the basement of a Presbyterian church,
mm,
and it was a gay men's VD, venereal disease clinic. And that's what we were known as, the Gay Men's Venereal Disease Clinic. And a lot of the issues I'm finding that Black, brown, and trans individuals have with Whitman Walker is that very history of us being a white gay men's organization. And so I took that question to the panelist because you were the people that were on the front lines and deserve to know that this is the rhetoric that's being shared about your story of starting this organization and being on the front lines. And of course, in their minds, and I'm not going to take this away from them, they did what they could do. They took the resources and the knowledge that was at their disposal at the time while watching countless members of their own communities die in front of them. They did what they could do to start an organization to take care of the issues that were right in front of them. Not having the language, the knowledge, the foresight to think about the rest of us. That doesn't make it right, but I think finally we have something tangible to say that that history, while it wasn't right, we can lay it to rest and we can move on from it. That these people that were there on the front lines started this organization that did their work. They did the best that they could, and that's the answer that they've given. So it's hard, it's not perfect, but I found myself walking away from it, and I get that I'm a representative of the organization. So that feeling that I got of relief from asking that question can't and won't satisfy everyone. But I think that there's something there. There's something sort of incredible there about being able to take that question and bring it to those that were actually there and give them the space and opportunity to think about those choices and decisions and how it impacts people today as they're telling the history of this organization with the complicated history of those communities.
Yeah. And I get it. And that's, I think, the best part about continuing to live. The best part about life that we get to keep living. I don't think it's ever perfect. I know me personally, I don't always ask for people's pronouns, and then sometimes I may use one that doesn't align with how they want to be referred. And, if people were to judge me on that part, I'm not perfect either. And I'm sure in the future we'll look back and be like, oh, so remember that time when we were doing this podcast and you left those people out or something like, I don't know. But I do think that an organization gets to acknowledge the past. There's no reason like hide it or pretend it wasn't true or like, no, let's defend it. It's like, no, that's where it was. And as we move into the future, it's like, here's how we're going to do better. Here's how we are doing better. We have people leading who are being more inclusive, who understand the different realities. And we're working to serve.
Yeah.
And also, I feel like in 2026, there are so many other fires that are happening. Like, we need to acknowledge the past, but like let's move to the future so we can actually get there. Because yeah, I think if we keep rehashing the past in some ways, we're not going to be able to come together to make a better future.
Yeah. And the other thing that I noted at that event was just for the crowd's awareness was my favorite thing about working for Whitman Walker is that they're not afraid of confronting that past and saying that we got it wrong and using those instances where we don't get it right to course correct. I think it takes a lot of not letting your pride get in the way because a lot of institutions fail at course correcting. That's where a lot of our major institutions struggle to really reclaim the narrative and the harm that they cause is just course correcting, acknowledging that you did something wrong and then using that as an opportunity to learn and move forward. And if more of us operated, I think just from that perspective, we could see so many important changes.
Yeah. And like also a little bit saving money. Because a lot of times people spend stuff to defend something in the past and like, but what if we just learn from it, build off of it, acknowledge that? Because like I've been a part of some organizations that things didn't go great. And yes, the people in charge they made the best decisions they could at the time. But like looking back, okay, maybe things could have been different.
Yeah.
And I think the more time you spend on trying to defend the past versus the acknowledging and coming back and like, how do we fix this moving forward? I think it's just better and it builds more trust in the community because, hey, we messed up and we can acknowledge it
Yeah.
and we can bring that out. Well, okay, okay. So so right now, when you think about your role with Whitman Walker, what are ways that that y'all can be supported? Like, what can people do to support you in your role and or Whitman Walker in their efforts?
I love this question because it's really the premise of my work today is getting people to rally behind the fantastic work that Whitman Walker is doing today. We're really on the front lines of LGBTQ competent, HIV competent care. We're one of the last major organizations that, alongside our primary care work, can boast that sort of level of competency in the community. And so we know that we have a very solid base of queer folks that have been patients of ours and continue to be patients of ours, but we need support in bringing in new faces and new voices into our fold to weather this storm. Because we're a primary care agency now, we can see so many more people, and there continues to be this perception that Whitman Walker is only for people that are living with HIV or only LGBTQ identified. When the reality is that we can see pretty much anyone. We see youth ages 10 and up. So you can come to see us for a dentist appointment. You can come visit one of our pharmacies at rates better than CVS and your main major brand name pharmacies. Come to us if you need insurance. We can help you get insurance. As Mayor Bowser says, no one in the district or beyond should be uninsured. And so we're right there alongside her, making sure that is a lived reality for folks that thought otherwise. We need new patients. So I would encourage anyone listening to visit our website. That's whitman-walker.org. It has all the latest information about what's going on, current events, article publishings, but really organized and aesthetically pleasing information on how to become a patient, the depth of our services, including our research initiatives through our institute, and information on how to become a patient, most important.
Okay, awesome. And we'll definitely have links to that in the show notes so people can follow through there. Cool. So, I'm gonna think, is there anything I should have asked Whitman Walker related before we move into the next phase of this?
Just returning because it's Black History Month, I want to just make note that Whitman Walker also takes Black History Month in general very serious. So I'm very happy to be here for a Black History Month episode.
Hmm.
For us, Black History Month is about uplifting the voices of our staff during this month. We have so many incredible providers and members that work in our administrative staff that reflects the communities that we serve. So as we're doing this work in Ward 8, one of the pluses of coming to our provider's office at the Max Robinson Center is that odds are is you'll get a provider that looks like you in some sort of fashion. For our queer folks, we have still have a ton of queer providers that work with the communities. So even from behavioral health, you can see a queer provider to handle queer issues. As we're connecting with more Black women, we have Black women providers that run the full spectrum of services. And so I think that's something we're really proud of to still be able to say that we offer and stand on. And even down to the intricacies that people don't really consider. The construction of the Max Robinson Center was largely based off of Ward 8 based constructors and contractors. So we're very much planted in the community, rooted in the community, as we would say, still around, still kicking, and very honored to be here for the 100th celebration of Black History Month.
Awesome. Okay, so now I have two different directions to go with the next question, and we're just gonna go there. So, as a Black queer man, what is a vision you have for our Black queer community, for the next step for our Black queer community?
My vision for the Black queer community is to finally be able to have a generational conversation without it going left. It has been my experience that facilitating generational conversations between really any group of LGBTQ plus identified individuals has been very difficult. I've been to
Hmm.
the conferences, and I think it's just because there's that age gap of misunderstanding. You have older generations that have been on the front lines and continue to be on the front lines that I believe have not seen the fulfillment of the prophecy that they created, which in a lot of ways for me means that the work that they've paved the way for the next generation to take on, there hasn't been much room for the younger generations to take up that work. And then for younger generations, there's certainly not perfect. I think there's been increasingly more disinterest in taking up that mantle from younger folks, folks that are just not as interested in doing that work of bringing the communities together and doing it in a way that's not about self-interest, which is the key there, folks. So I think in order for us to have a real generational conversation about what it means to be a mentor, to have mentorship, what the AIDS epidemic really meant for older generations, what are the problems that our younger generations are experiencing, the lack of attentiveness, the social media withdrawals and exhaustion. How do we begin to bridge some of those gaps with the wealth of knowledge that already exists on the full spectrum of our community, regardless of age? And I think that would solve so many of our problems. It just does not make any sense, but it's hard to get us to talk.
That's fair. That's fair. I definitely don't see enough intergenerational conversations and communities. I only find them in like good sub communities. We're all together for this reason. And actually, we actually have people from every generation
Right.
all working together. Like last week, I was at Creating Change, and in that room, you definitely saw people who have been going to Creating Change for 30 years, and then people who are in college right now, and this is their first one, and like we're all in the same rooms together.
Yep.
But yeah, and it'll be really interesting too, because I think sometimes it's I don't know, how do you trick people into being in the same place? And then giving themselves a little bit of patience to get that perspective.
Yeah.
Yeah.
It's hard because I think right now it's just not the right time either. I guess there's no perfect time, but it feels particularly like we have so many other problems that we each as individuals have to face on a given day that is it even worth it
Mm.
to extend that amount of effort to bring us together to have a conversation that may or may not result in anything. But folks like Racine, who I love,
Mhm. Yeah.
continue to push the boundaries in that area in so many ways. I found a lot of my strength too as a young person coming into DC by looking to those folks and building community. You know, I have more folks that are Racine's age as friends than I do folks that are my age. And that's something that I'm proud of because those people look to me as someone that they feel comfortable passing the baton to. But for me, it's been about putting in the work to do that, but not from a self-interested place, from a place of just loving people and wanting to protect my people and noticing the gaps there that I could do
Hmm. Yeah. Yeah.
it.
We love Racine. She might be on the podcast sooner than later. Um, but yeah, because I think mentally it's easy to get into a box and be like, okay, I fit into these boxes and those people are in some other box. So like we couldn't talk together.
Yeah.
I do really appreciate it about Racine too, because like she's been putting the work in for years and it's still going and it's still attending things and seeing and being like, I will show up to your events, I will speak at your event. And she's just a really great presence. And I wish there were ways, yeah, to figure out how to connect with younger people to like, okay, y'all got to sit down and like, show up to a thing with her. And if you're in a conversation with her, I think she is a good example of someone who's like you said, loves people. So even if someone's like super young in their 20s or whatever, if they were to have a conversation with her, it wouldn't be like you must treat me this way because I'm Racine. It's going to be like, hey, I'm a person, you're a person, let's have fun, let's joke, let's have a
Yeah.
good time. And I think it's finding that way to bring both together. Because I think it's not just like, hey, young people, shut up and listen to the old people, but like,
Yeah.
you're valued, you matter, and your perspective matters. So it's you're not just being invited, but like you're part of this. Like, how do you co-create the conversation with the youth? And I like that vision. And I think there were some ways to get it done. It's just you got to compete with everyone's attention and time. But I love that. I love that vision. Yeah. Oh, yeah. And I think there will probably be things happening this month. A lot of events will happen this month. And I'm hoping that the people leading them let me know. Yeah, I'm promoting because every so often I hear about an event. I'm like, wait, why did no one tell me about this?
Well, as they let you know, you let me know, and then we'll go
Yeah, we'll
together.
put it all out there because yeah, there's a lot of history, especially here in DC, a lot of Black history, and then a lot of Black queer history, and a lot of people who've just been part of the movements. And yeah, as long
Yeah.
as the weather cooperates, I look forward to that. Hmm. Okay. So last year here in DC, we hosted World Pride. That was a lot, but
Oh.
good. It was good.
Yes.
Right? Like 3.5 weeks of things all every other day, if not multiple things all at the same time on the same day. So one question I've been asking guests is, what does pride mean to you?
Pride, very much like Black History Month, is the acknowledgement of the past. And for Pride, we know it started as a riot. It started from this opportunity that queer individuals saw to take control of their narrative, to not be forced out of their establishment. And it happened at the perfect moment in time where people were hungry for that sort of revolutionary spirit today. And I think rightfully so, Pride is a party. We as queer people don't get as many opportunities to simultaneously acknowledge that history while also celebrating how far that we've come in shared space together, regardless of race or gender identity. And so I think there should be fun and a lot of energy and a lot of sex positivity and body positivity and all the things that make pride. It's about freedom, freedom of expression, freedom to be, that coincides with the history, the complicated history.
I love that. And I think that's one of the things I love most about Pride season. It's not just the one weekend, it's the whole season of it. Personally, I love the idea of the parties on the weekends, but also I love the daytime events that happen.
Yeah.
Not only do you get more sunshine, but they also might be inside, so it's AC. So like last year, I did too many things. But every year I try to go to like, Silver Pride. It
Oh,
usually
yeah.
happens like during the week somewhere. And it's great to like see the queer elders out there. Racine's usually been a host of at least one event. But also you get some of the conversations and you get some of those sharings. And also you get there and you're like, wait a minute, but these people like decades older than me, why are they making jokes that are funny? Like, why am I enjoying? Like, we're all having a good time. And it's like, it's just a good smile. It just puts a smile in my heart, and it's just like this is fun. I love it. Totally suggest that everyone should go to Silver Pride whenever it is. It's fun. Just bringing people together, celebrating the past in the present.
And as I was saying, oh, queer people don't have enough moments to get together. I was literally thinking about MAL that just passed.
Oh yeah.
And I was like, oh, wait, we do have moments. But then, even to that point, it's like MAL, Mid-Atlantic Leather, for those who may not know, it's still for a very niche community, like a sub community within
Yeah.
the community. So I think even those events where like folks are going to Fire Island or the Black community will go down to Atlanta for various holidays or whatever.
Hmm.
I think those are still very niche moments where pride feels like more of an opportunity based on your city or even nationally for us to just all be together and for there to be those sub community events or, niche happenings, but the spirit of Pride is like we're all together in the room at one time, which is very beautiful.
Definitely. I love that. And I think about that a lot. And there's this balance of, okay, how do we all get together and enjoy our sub communities? Because
Yeah.
every so often, like, worst case scenario or very general scenario, music, right? Like, we can all be together. And like, if you were to have a music festival where every artist was like a different type of genre, that could be different.
Yeah.
But if you're like, hey, we're all together, and then you're like, all right, this hour and a half and that hour and a half, and then it's like you get to like, enjoy the different diversities within our community. Yeah.
Except maybe when it comes to Beyonce. I think that's something we can all get behind.
I think we should, but because of her success, there are some people who are like, I'm anti-Beyonce, and now I have to stay anti-Beyonce because they've been anti-Beyonce for decades. Um, but yeah, but I am excited for her new album. I guess someone said it's coming out this year. So it'll
Trust.
be interesting to see how that goes and the feedback. I went to my first Beyonce concert last year and was like, oh, I should have spent money earlier in my life. But yeah, so I'm excited. I'm excited. Okay, okay. Let's see. One last thing in this section before we go to rapid fire questions. Okay, imagine if you can make one change to Pride. Like, what's one extra thing that you would love to see at a future Pride event?
This is gonna sound so corny and I'm a nerd, but I promise you all, I live for the partying. But I really wish more people would go to the information sessions. If I could just like poof and have more people like attend. There are so many great resources. And then it's hilarious that like you'll be partying and then maybe it'll come up in conversation, oh, I haven't been tested, or oh, I haven't been to the dentist or whatever. And it's like literally, if you would have went to the resource fair there were tons of people there. Like even I remember at Black Pride this past year, I think Verizon was there, like helping people get Wi-Fi and new
Oh,
phones. And I'm like, why don't people come to this stuff? Like, I get the partying, but there's also cute boys in the lines as you're like waiting for resources. So I wish more people would go to the resource fair.
yeah. Maybe they just need to be like informational party or like something like be branded. Because honestly, information session does seem like I have to sit in a chair in a room, like it's almost like school again.
Yeah.
But yeah, like it's also hard too, because like people information session means like I'm gonna learn something, maybe.
But it's
I
all
don't know.
so from my perspective, and I'm biased because I'm usually like a
At a table,
volunteer
yeah.
or something like
Yeah.
that. But in the conversations that I have with tables next to me, or if I'm like actually attending or just listening in, there's so much great information. And like I said, in talking to some of my mentors and older friends, just learning about the origins of Black Pride in DC or learning about the work that trans trailblazers are doing today, even in reality TV spaces or upcoming cruises or things that you could just be a part of, like other community events that take place throughout the rest of the year. There's so much fabulous stuff going on in the resource fair. Just give it like an hour and then go back to party.
Yeah, yeah. So I'm always wondering, like, okay, how do we make some of these things a little more real? Like, how do we even if sell it differently?
Yeah.
When I told people about Silver Pride sometimes, I'm like, okay, it's inside in the summer, so like, it's gonna be air conditioned. There's usually refreshments of different kinds, and it's probably gonna happen like earlier, so you can like start your Pride celebration at 4.
Yeah.
You can remember people, the sun's out. It's just a good time.
Yeah.
But okay, okay, better information sessions. We'll see. Pride's a few months away. I'm sure there'll be it'll be an
The
interesting.
irony of Pride then coinciding with the, what is it, 250th anniversary of
Yeah,
America.
it's gonna be an interesting summer because there's the 250th anniversary of the US. It's gonna be interesting. And because the current president is who the current president is, it makes it even more complicated because there's this challenge sometimes where it's like this person has a way of making things very about himself, but it's also about the country. So there will be parts where it's like it's about the country, and you're like, oh, you know what? I can get behind that. But then if it's to himself, then it's like, yeah. Or he's just like, okay, that actually was a good point, but I don't want to give you that kind of credit because you will take that credit too far. It's just a weird time, but we get to live it and we get to be in community together. And I'm sure there might be some outside of DC Pride celebrations that will be different, more fun.
Yeah.
So, are you ready for some rapid fire questions?
All right, let's do it.
Okay. So, first question. What is something that inspires you and why?
Something that's inspiring me. Quickly, quickly, quickly. Why is this so hard? Okay, right now poetry is
Ooh,
inspiring me. That was something that during that little period when I first moved to DC, I put down. I stopped writing, but I used to be like a very serious poetry writer. I'm just now getting into a lot of different kinds of poetry. I don't know if people know, but Lana Del Rey has a poetry book out
interesting.
that I love. Some Black poets, of course, I love Langston Hughes is like one of my idols, just going back to Harlem Renaissance. Poetry, yes.
Okay. Poetry. And you also write poetry.
And I
Is
write,
that
so I've been
correct?
writing more as well.
Okay. Awesome. Awesome. Tell me when you're gonna have a reading. Like,
I, I definitely, that's the next step.
there are open mics, some more attended than others. So, you go to a little small open mic and just, throw some things out there.
I should do that.
You never know. You never know. Okay, cool. Next question. What is your favorite self-care routine or activity?
I love getting massages.
Hmm.
Massages are so wonderful. It's like the best thing in the world. Like Reiki sessions as well, just being able to focus on like my energy as a very introverted person, ridding myself of like any negativity, saging, and then accompanying that with like physical touch. So like having the body rub down, getting that physical stress up off of me. Beautiful. Love it.
I'm a big fan of massages. Okay, next question. Do you have a favorite joke?
No, I'm a Capricorn.
Oh,
I'm very serious and I don't do the corny jokes. I'm sorry, America.
okay. Is there something you recently laughed at least?
I'm watching Rachel Sennett's show, I Love LA on HBO, and that's been giving me a tickle because I'm an East Coaster through and through. So like any sort of parody of West Coast behavior, like Portlandia, that just mimics that sort of like hippy dippy, what's the word I'm looking for?
Crunchy.
Like a
Yeah, like the West Coast vibes.
hipster. Yeah, like those people, it's hilarious to me.
Okay. Thank you. Thank you. I asked that question one so I can collect jokes, but also two so I can laugh at things. So if there's more like recommendations, joy and laughter.
Yeah, but I do love to laugh. I am a serious person, but I love to laugh. I just don't tell the jokes often.
All right. Nice. All right. Ooh. So, who is a queer change maker that inspires you?
I am inspired by my mentor, Terrence Payton. Many people might know him. He is a big wig at DC Health in the HOSTA administration. That's the HIV department within DC Health. Terrence was a leader of the Health Impact Specialist program, is the creator of that program,
Mhm.
and is someone that I credit with helping me through my own personal identity crisis with coming out to my friends and family, but also focusing on that career advancement and realignment, like really helping me to secure even this position at Whitman Walker. And so while those things are very specific to my personal journey, Terrence has also just been on the front lines of helping, in particular, Black queer people take control of their lives and do better for themselves, and is the example of that bridging of the generational gap that I spoke of earlier, but lived in reality. And I love him so much.
Awesome. Thank you for sharing that. I appreciate giving people their flowers when they're alive and, having people who are just like, these are just people in our community who are making change.
Yeah.
And we love that. Okay. Well, thank you so much for being here, sharing your story, sharing what you're up to. I've enjoyed this conversation. I look forward to the rest of the year, being a part of some of these Whitman Walker community events that y'all will be doing, seeing you at information tables, going to these information sessions slash parties, because what's more of a party than, don't know where that sentence is going. I was trying to make like a pun, like what's more of a party than health or something, but doesn't matter.
I
This is
would.
why I edit what I do.
I am formally in my role right now of representing Whitman Walker as community engagement manager. But if you have me back, we can have a couple of drinks and I'll be Coach Dwight and we can have a more PG-13 rated R
Okay.
conversation.
Like a life coach, Coach Dwight. Okay.
Yes.
Good to know. You just might. Thank you for being on the show. And now the final question, and it'll be the end of the episode. Do you have a piece of advice or a guiding word of wisdom that's been helpful for your journey?
Life is not linear. You can have all the plans in the world for yourself, but it will always rain. Rain is not a bad thing. Rain is about bringing forth new life and reinvigoration, rejuvenation. So, as you're living what you feel like is a linear version of your life, expect there to be zigs and zags, expect there to be rain, but it will ultimately guide you to the path that was destined for you. Period.
Thank you for listening to this episode of Queer Changemakers. This is Justin, and I hope you are able to get some inspiration and maybe some ideas about how you can take action to create positive change in your life, communities, and beyond. See you next time.